schools have gone back, social workers across Britain are seeing a spike in referrals, and it's putting a strain on the system. So Martin, where do you believe the pressure sits within local authorities to deal with this rise in referrals?
I think the rise in referrals has been a direct result of the pandemic that we've been suffering for the last 6 or 7 months. Young people have been not very visible over the summer, and whilst social workers across the country have been wonderful in trying to keep in contact with the children that are on their books, as it were, open to them already, our normal referral routes into social services, i.e. through schools, health visitors, doctors, and other community resources, have been severely curtailed because of the coronavirus. So with schools coming back to some sort of normality in September, October, and with the lockdown being eased in August, young people became a bit more visible. And I think that we all anticipated in social work a spike in referrals, and that spike in referrals is occurring. Now, those pressures start at the front door, where the referrals are triaged in most local authorities and then passed on to teams of social workers to undertake the assessments. So the work that's coming in, we're finding, is more complex, quite entrenched. Young people are making disclosures about things that have been going on for months, and social workers are trying to make assessments of those situations, safeguard children, and come up with coherent plans to take these issues forward. Now, if we have to go into child protection processes, again, that's become challenging because of the way we have to run child protection conferences and the way the courts are being run. So it's kind of been a perfect storm, really. We've anticipated the problem, the challenge, and it's come. Lost people along the way who've given up or gone home or needed to look after themselves or look after others, and local authorities are struggling, I think, to backfill posts with experienced social workers. Most local authorities that I work in are able to recruit newly qualified social workers, but you can't fill a child protection team with newly qualified social workers and hope to get quality assessments done.
Yeah, I think just picking up on Martin's point, I think the complexity, I think it is a perfect storm. The complexity of cases is unprecedented. We already knew that the complexity of presentations was going up pre-COVID, but I think we've got to look at this holistically. We're facing a pandemic which is we've never seen in our generation, which I think causes an enormous amount of mental stress and anguish on children, but actually on parents as well, and I think that pressure is potentially manifesting itself in terms of the family dynamic. And as Martin alluded to, there hasn't been eyes on the ground. There hasn't been those touch points that would normally be the safeguard to capture it early. So it manifests itself. And then the second thing to complement that sort of perfect storm is the demand pressures. We can't underestimate, it's difficult enough on a normal working day to conduct the work, but actually now you've got all the considerations of, how do we do this in a safe environment? How do we triage these cases? How do we get access to, other agencies to support this, because other agencies are swamped, schools are having to put measures in place, having to manage situations, the police are, health services, there's a lot of public services that their sole focus is responding to the pandemic at the moment. So the pressures across the system, I think, are making it difficult for social workers to do their day-to-day job as well.
But I think that we can look at it from a much wider perspective as well. I think the point that John just made around the other people with agency and involvement are significant. The demands on schools right now, or during the first half term of the year, with the returning just dealing with all of the situation, delivering education without the concerns of all of those other social care points, picking up a lot wider kind of spread in that kind of regard, then arranging it and then referring it and then picking it up as well. Bizarrely, I think that when the pandemic came in, the shutting of the schools and the disappearing and the lesser visibility actually gave us a certain amount of space to start delivering services in a different way. You know, the immediate transfer of the work remotely, the introduction of webinars, you know, is having meetings across this 9 months ago would have been unthinkable. And the work hasn't disappeared. It's probably got greater, but now it's all coming in at one fell swoop. I think the point that Martin makes around newly qualified workers is very apt, but I think it can be slightly overplayed. I think that we have to realise as well is that it's the ability to support workers to conduct the kind of work that they want to do. It's not for necessarily lack of ability. It's not necessarily for lack of support. It's not for necessarily lack of experience per se, but it's being able to conduct those things correctly in the right environment at the right time, which might, you know, which are extra pressures on managers as well as practitioners, and being able to deliver that. So and I think it's that sudden pulse through of work at one go that really could create significant, well, it will show up vulnerabilities within certain departments, within certain local authorities, or pressure points within there that we probably knew existed, or leaders probably knew existed, but might not have actually had seen that pressure come onto them at that time.
Yeah, I think I would agree with that. I think our experience in the local authorities we're currently working in is that there was a lull. The pandemic first hit, and you know, people were scrabbling around thinking how to work differently. At ICS, we've always piloted remote working anyway, so we were quite comfortable with using this sort of technology to keep in touch with our people. And you know, it was quite easy for us to make that transition to a more remote model to support the young people that we were working with.